So even if you're in the United States and healthcare is sometimes, I guess, a luxury, you can never deny someone treatment based on what their insurance does or doesn't cover. And you actually see this a lot if you ever, or when you start rotating with physicians and stuff. Um, they'll always go out of their way to like try and make something work. You know, theoretically, I've been with some physicians, who when the insurance said, oh, they have to go through like months of this one drug, but they just went through like months of like a drug with the same mechanism and it doesn't work. The physician just says, okay, well, we're gonna put you on this drug for 2 months, quote, and he actually just gives samples of the other drug. So that way, when the time rolls around, they can say, oh, well, the trial didn't work, and then they're covered for whatever. The point being, that either with samples or with whatever, you'll end up finding that a lot of physicians are, and in my experience, all the physicians I've worked with are really good at trying to do what they can to give people what they need. And of course, the idea is you can't really limit someone's treatment based on what they can afford. You say, we'll worry about that later. That's typically what the question's going to ask you. They say, like, oh, well, we'll worry about that later. The important thing now is making sure your lungs don't explode. Identify and normalize fears and feelings. This actually applies more to just 7-year-olds or young kids who just started understanding what death is about. Identifying and normalizing someone's feelings and someone's fears is something that you do every single day. Not just in your life, but also it's very applicable to medicine. The problem here is when you kind of go too far and you start identifying things that aren't there. So make sure you're perceptive enough to catch that. Intimate partner violence. We had previously talked about with like adults versus children and the elderly. How do you deal with like different things? Guess it wasn't on this one. But we said how if you're a child and you suspect abuse, you have to report it. If it's elder abuse, you have to report it. But if they're both adults and consenting and willing and normal people, then you can't just go around like reporting stuff the same way that you would for a child or for an adult and for an elderly person, because the implication is that they have the physical and mental wherewithal to deal with their problems how they see best. And I guess it's some pseudo breach of autonomy if you do that. But the big thing is this. This is always the answer on the test. All right? You don't say, you better leave this person. Never say that. That'll always be an answer option, and that's always wrong. It's always make sure you have a backup plan, and then something that I've also seen is hand them your card and say, or you hand them the card of a local women's shelter. That's actually it. And or whatever, men's shelter, if those things exist. So this is similar to the one where the person said that they want an unnecessary procedure. Not that holistic medicine or whatever is unnecessary, but you should approach it in a similar way. You should say, why do you want to do that? And then kind of treat it the same way that you would treat anything else or advise someone with anything else. You would say, well, let's look at the benefits and risks of that. Here's my opinion based on that, and blah, blah, blah. Don't show up to work drunk. And yeah, I haven't really seen any questions on this, but this pops up a lot when you're studying for like neurology and stuff. And yeah, when here's someone's, dead, you can take them off life support. And keyword here is gently. You can't just say, hey, listen, dummy, I'm going to do this. Be gentle about it. Always reject pharmaceutical offers. I know that pharmaceutical sales reps, they give lunches and stuff, but that's been cut down a lot from what it used to be in years and decades past. The idea is that you don't want any dirty money in anything. You don't want people saying, oh, they're only doing this because you're getting paid to do that. This isn't like Congress where, lobbyists can just give you tens and tens of thousands of dollars and you can keep your job forever. Physicians are held to a much higher standard. than politicians. Unfortunately so. Not that it's bad that physicians are held to this high standard, but politicians should be held to an extraordinarily high standard as well. Oh. So you are allowed to refuse to do something if it goes against your religious beliefs, kind of like if you don't, I don't know, like abortion or something, or you are allowed to to say, hey, I can't do that for religious beliefs, but you can't just leave them hanging. So that's where you say, my friend Joe has experience in this kind of stuff. So you do that. We'd already talked about one of these cases. You cannot deny emergency first line care for minors. But here it says based solely on faith. So I assume it implies that there were some reasons that you can. But off the top of my head, with all the questions I've done, I've never come upon a question that was just like, oh yeah, don't transfuse the kid. Unless of course like the patient had like a known history of like transfusion reactions based on a specific kind of transfusion. But you always give minors first line care for emergencies, regardless of what the parents say. And child presents with injuries inconsistent with parental story. So you suspect child abuse, and you always report it. So typical things can be retinal hemorrhages in infants. It can be, inconsistent burn marks or symmetrical burn marks or something. Anything that raises suspicion, you have to report it. Unless there's like a very plausible explanation, like if someone's a hemophiliac and you got a child who keeps bleeding and stuff, then you gotta do some more digging. Maybe it turns out that parents aren't beating the kid just a hemophiliac, but unless you have some extraordinary circumstance like that, you should have a very high index of suspicion.